Horne. I'm a student physical therapist. Today I'm going to do a clinical test for deep tendon reflex of the biceps, and I'll also be doing a spasticity test for the hip adductors, and then I'll be describing the pathway for the medial reticulospinal tract. So first, the deep tendon reflex of the biceps. You want to use a reflex hammer, but I have a mallet that I'm going to be using today because I don't have a reflex hammer. So for the biceps, you're going to be having the patient relax their arm. You're going to be tapping on your thumb, which is going to be placed on the distal portion of the biceps tendon. Okay, just relax. And I'm getting just a slight muscle contraction here. Okay, and I'm going to test both sides. Just relax your arm. Okay, relax. Okay, so I'm getting just a slight muscle contraction, which is normal. The grading scale for this would be 0 to 4. They use pluses and minuses as well. So 0 is no muscle contraction or no response. 4 would be a kind of a repeated reflex pattern, which would be a hyper response to this. It would be like a clonus. And then normal is a 2 plus. So she's a 2 plus on this one. Next we're going to do spasticity test. For this, I'm going to have her lay supine, if you want to put your head up on this end. Okay, so for the spasticity test, I'm testing the adductors. So we'll start with her right leg. What I'm going to do, I'm going to move her opposite leg kind of out to the side so we can get full range of motion. I'm going to first just test what her available passive range of motion is. Just relax. Okay, so I'm going to start her in full adduction. So the muscles are shortened. And I'm going to move her through full range of motion quickly, within about 1 second or so. So just relax. Okay, and what I'm filling for is any increase in tone. The grading scale on this one is also 0 to 4. 0's no increase in tone. 1 would be a slight increase in tone, and you might feel like a catch where you're moving and it catches, and then it kind of releases throughout the rest of the range. So she didn't have any increase in tone or catch, so that would be a 0. I'm going to test her opposite leg as well. So first I'm just checking her available range. Okay, just relax. All right, and she's also has no increase in tone on that side as well. Okay, you can sit up if you want. Now I'm going to describe the medial reticulospinal tract. This tract starts in the pontine reticular formation, which is in the pons. It's going to stay ipsilateral, and it's going to descend. This is the upper motor neuron in the pontine of the reticular formation, and it's going to descend ipsilateral to synapse with the lower motor neuron in the ventral horn of the spinal cord.